Aesthetics is enhancing the aesthetic appearance of the skin. It makes it look better. It doesn't physically affect it. Medicine treats unhealthy conditions of the body. So there's prescribing, diagnosing, and treating. And those are all medical practices. Like, let's say you look at somebody's foot and you say, that's a fungus. That's a diagnosis, because you don't know that it is a fungus. It could be something that's not healthy, but you don't know if it's a fungus unless it's actually cultured and goes to a lab. But if you say that's a fungus and you say, buy this stuff, put it on twice a day for 6 weeks and it'll go away, you have diagnosed, you have treated, and you have prescribed. And let's say it isn't a fungus and that Miss Jane client listens to you, puts this stuff on, and it gets worse and it gets worse and it gets worse because it's actually bacterial infection. But you didn't know that because you're not a doctor. You've actually kept her from seeking the medical attention she needed earlier by having her wait this 6-week period thinking it was doing something better. So there's a fine line between what will affect the body and what makes things prettier. Come on. All right, aesthetics scope of practice. This aesthetics refers to any of the following practices: giving facials, applying makeup, performing skin care, removing superfluous hair from the body by waxing or tweezing, depilatories, which means like laser hair removal. That's not a depilatory, and it's not waxing, and it's not tweezing. So laser hair removal is not within the scope of practice of aesthetics. Applying eyelashes to a person, brow and lash color, beautifying the face, neck, arms, or upper part of the body by use of cosmetic preparations, antiseptics, tonics, lotions, creams, massaging with a cosmetic preparation. That doesn't mean doing a therapeutic massage. If you're going to give a 1-hour body massage, you have to be a massage therapist to do that. But you can massage the body part that's within your scope of practice during the application of a cosmetic product. Cleaning or stimulating the face, neck, ears, arms, hands, bust, torso, or legs by means of the hands, device, apparatus, and appliances. And okay, you think it's by a machine, so can I use this machine? Depends on what type of machine it is and what it actually does. And I know this is kind of confusing. This is your Florida. Is anybody here not from Florida? Are you guys from Florida as well? This is your facial specialist, which is technically an esthetician here, even though you don't have that name. This is what you can do. You can do facials or massaging or treating of the face or scalp, and that doesn't mean medical treatment. That means you can treat the skin. Facials is massaging without the use of mechanical devices, using oils, creams, lotions, cosmetic products to cleanse and condition or prevent or correct problems of the conditions of the skin or face, and to color and beautify the face, neck, and hands features. Skin care means the treatment of the body, of the skin, other than if you're using a sponge or a brush or similar device. And then it says, this is a law down here, such services may not involve massage as defined in subchapter 480.033, because that's the statute that covers massage therapy. So if you're doing just massages, you need to have the massage therapist license and comply with all of those laws and rules. The practice of medicine, and this is from the FDA, means the diagnosis, treatment, operation, or prescription for any human disease, pain, injury, deformity, or other physical or mental condition. Please don't prescribe things for people's mental issues, even though you do tend to be a therapist when you're in a salon. We had a question earlier about, I've bought some different machines and I'm using them in my salon, and then somebody told me I shouldn't have them. And so she made many, many phone calls to the board and inspectors and kind of got the runaround and never really got an answer. Can I use this machine in the state of Florida? If you're going to use a medical device or do a medical procedure under the delegation or supervision of a doctor, in Florida, it has to be a licensed physician licensed in the state of Florida. You can't have a doctor from Ohio oversee or supervise what you're doing in Florida. The doctor, whatever he's prescribed, he, she, doctor, it has to be within their, consistent with their education, training, experience, and active practice. If you're going to do skin peels on the face, an OBGYN does not count, because OBGYNs do not actively practice on the face. Dentists work on teeth and bones. They do not do laser hair removal in the bikini region, even though apparently there are people, hypothetically, that would do that. So keep in mind, it has to be, ideally, it's going to have to be a plastic surgeon or a dermatologist, because those are the people that actually work with skin on a regular basis, all over the body, but certainly on the face. Routine technical services not requiring special skills of a licensed physician. Doctors can delegate brain surgery if they want, but they're responsible. If they want to bring you in the operating room and hand you a scalpel and say, hey, go right ahead and just take out that part of her brain, they would be responsible for that. If you did that, that would be a bad idea. But some of the services that a doctor can delegate have to be delegated under supervision. And sometimes it's direct on-site supervision, which means the doctor has to be present in the building, in the room where the service takes place. He can tell you, put this chemical peel on the person's face, leave it there for X number of minutes, and take it off. If the delegation and supervision requires direct on-site, he needs to be standing there, watch you do that. Sometimes it's in the building, but not necessarily in the room. And so you're going to have to go to your medical board website and know that, sadly enough. In Florida, direct on-site. Hair removal, laser, IPL, electrolysis, direct on-site. There has to be a doctor in the facility and there, and it has to be a dermatologist or a plastic surgeon, not an OBGYN, not a dentist, not a psychologist, or it has to be somebody who's actually practicing in those things. For aesthetic skincare, like lasers for hair removal, Botox, and all those things, those are medical. Medical personnel have to do them, and doctors have to prescribe what is going to happen and who's going to do what. Does that make sense? Plastic surgery. And in Florida, oddly enough, it actually says within the doctor's active practice and training, and the doctor has, if a doctor has two or less offices, it has to be within 25 miles of where his primary office is, but not more than 75 miles away. Truly, but this is in the Medical Practice Act. So again, for you to know what the supervision and delegation is, you have to go to the medical board in the Florida website and find out what delegation and supervision is where you are. Because let's say your doctor has 7 offices. Can it be 100 miles away, or does it have to be on site? And it's kind of sad that you have to go there, but you do.